as a result of that, Orbis Ireland has got together as a board and decided that we would like to get involved in this charity and support a grand project in Ethiopia. So we have a grand project in Ethiopia in a region of over 2 million people. And when we started 10 years ago there was a very, very high prevalence of trachoma, which is a blinding eye disease. It's a little bit like conjunctivitis, but a much worse version of that. And it causes your eyelashes to turn inwards, which means that every time you blink, your eyelashes are scratching the front of your eye. And if you think of what it's like to have one eyelash in your eye at any time, which is incredibly painful, imagine having all of your eyelashes in your eyes. So anyway, we can proudly say that after 10 years there, we have reduced the prevalence of trachoma in the region by over 75%. We still have further work to do, but I want to say thank you. Many of you who have supported us over the years are here. And Michael and Caroline, there are two great supporters here beside me, but many others have also supported. So thank you so much. And obviously any support that anybody can give in the future would be great, because we would love to eradicate the disease completely from this area. So thank you so much. As I say, we're involved in a grant project in Ireland, but the Orbis Eye Hospital is basically our flagship, and you will hear more about that on the plane when Moss is going to talk about that. Okay? Thanks a million. Okay, what we might do is try and get a group photo outside. So if everybody just goes up the steps and stands one step down, and we take a nice photo of everybody either side on the steps, okay? Yeah. I know it's raining, so we'll try and do it quickly. Okay. And Ross and Matthew, with the plane. So you
Probably, maybe the turbines.
No, what we do in a second. You can, come here. 4-year-old. You want to sit in there, guys?
Step 1 foot in, press down, lift up, same thing inside.
We've got to let the real kid in.
Daddy, you can't photo.
Hello.
Hello.
Go get the facility. You can come down and have a look at it later. Yeah. Get your plate. Yeah. absolutely, everyone has been so supportive to get literally so many people through this amazing aircraft, so thank you so much. Anyway, welcome on board the Orbis MD10, the Flying Eye Hospital. It is brand new, and you get that nice smell, don't you? The sort of the new car smell sitting on. But actually, the aircraft was built in 1971, and the aircraft was donated by FedEx. And what we did was basically gutted the whole aircraft, and then slid these series of modules. As you go down, you'll see blue lines on the floor. And that's where we put these different modules. So the examination room, the operating theatre, the recovery, the CSSD, they're all different modules, and they literally can be slotted into the aircraft. If God forbid anything happened to the aircraft, we'd be able to swap these modules in and keep the eye hospital going. So I think this is a absolutely unique aircraft. We've had a number of keen aviation experts on the aircraft over the last couple of days, and it really is unique. And this aircraft does two things that are really important. Number one, you are sitting in the lecture theatre of a teaching hospital. And what happens is when this aircraft goes into developing countries, we bring patients on board here and also patients in the local hospitals, and we operate them. And the idea is not to do as many operations as we can in that period of time. Our mandate is to teach as many doctors, nurses and other clinical colleagues in terms of how to do our best practice around doing site-saving operations. The second thing that this aircraft does, and that's partially why the aircraft is here over these couple of days, but also more importantly when we go to developing countries, is to let governments know that the scandal that is preventable blindness. 80% of blindness around the world is due to causes that are completely preventable. So people are going blind still to this day, not because of, well, they went blind and that was it, well, tough. They're going blind because of very preventable conditions. Claire on the bus spoke about trachoma, but cataract and a whole range of other conditions are completely avoidable. So when this aircraft lands in a developing country, governments sit up, take notice, they come around and they visit the aircraft, and it's our opportunity to give local governments an absolute flea in the ear about how they need to prioritise preventable eye care. And that's how the project in Ethiopia got going over 10 years ago. The Flying Eye Hospital started. The government were so impressed with the work we were doing in the aircraft, and as a result they supported us doing this programme over the last 10 years to eradicate trachoma. So this aircraft is a teaching hospital, and it's also a great advocate for change. So we're going to show a little video and then bring you around the aircraft, go to the examination room, the operating theatre, and then to the recovery room. So please do ask questions of the wonderful staff and colleagues here who are on board, because they're here to answer all your questions. And believe me, no question is too stupid, so please do ask all your questions. And we're so delighted, and you're so welcome to be on board this aircraft today. Thank you very much. Cheers.
Life is filled with beauty, hope, excitement, curiosity. All you have to do is look around. Yet for many, this is impossible. 285 million people in the world are blind or visually impaired, and in most cases, it's simply because of where they live. Places where a child can't learn because she can't see the blackboard, where a person can't get care because there aren't enough adequately trained doctors, and where an eye infection can cost someone their education, their independence, and their chance at a meaningful livelihood. The fact is, 80% of all visual impairment can be prevented or cured. This is where Orbis comes in.
Orbis is a humanitarian organisation. Our sole aim when we started was to try and help the world tackle avoidable blindness.
We work with partners to prioritise and deliver quality eye care that meets the needs of each community. We urge governments to put the most appropriate resources towards eye health, given that 3/4 of all visual impairment could be cured with a pair of glasses or a cataract surgery, two of the most cost-effective health interventions in the world today. We train and educate all levels of eye health providers, from village community workers to hospital surgeons, emphasising quality and safety standards for patient care. We do it with the generosity and expertise of a dedicated global volunteer faculty pool, numbering over 400 individuals across 30 countries, and a team of intrepid volunteer pilots, engineers and mechanics who operate our Flying Eye Hospital. a one-of-a-kind mobile teaching hospital on board an MD10 aircraft. Together with Cybersight, our web-based educational platform that provides our partner doctors free continuing medical education and mentorship from anywhere in the world. What started with a simple vision and a plane more than 3 decades ago is now a mission that has expanded to over 90 countries. And in the past 5 years alone, together with our partners, we've accomplished over 10,000 doctor trainings, 11.6 million eye exams, and over 340,000 surgeries. Giancarlo from Peru was one of them. Giancarlo, who was born with glaucoma and was experiencing piercing pain in his eyes, received surgery on the Flying Eye Hospital, accompanied by his father.
Pues única, ¿no? Porque al menos yo, así para tocar un avión, nunca, o sea, que pasaba por alto, ¿no? Y fue algo bonito también, ¿no? Porque sabía que en el avión lo iban a preparar su versión del hijo, ¿no? Sí, fue maravilloso, como dice, ¿no?
And we can do even more with your help. We can ensure that people like Giancarlo come a step closer to leading an independent, fulfilling and healthy life. And that a world once seen as dark and distant now offers endless possibilities. As global pioneers in eye health, we are entering a new era. We now need to grow and expand our programs to increase awareness and demand for quality eye care, to reach the marginalized and underserved, and to advocate passionately for the right to sight, so that no one has to face a life of unnecessary blindness.
Any questions? No? If no questions, then we can move to the next room, is the laser room. Then we have a staff there, so show you the people that are answering all your questions. Thank you.
Thank you. Thank you.
Not working anymore.
Generation 9 hospital. So this room here is the examination room, and we use patient examination. That is, in the morning, the patient needs to come here to the room first. So this is actually the first stop for the patient. So he has to come here, and in this room we have all the equipment here, and the doctor will do the final examination, make sure that he's fit for surgery, all the paperwork with all the equipment, and if everything is okay, then the patient will be moved from this room to the next room, and we will begin the surgery. So this area, we do the examination, and on the other side of the room, we have two equipment. You see these. This is not ordinary microscopes. These have a laser attached inside, so these are attached lasers, and we treat patients with this equipment who have a cataract or glaucoma diseases. So in the program, while we are doing the program, every equipment here has a camera. This camera will transmit a live video to the monitor, all the monitors, and to the main monitor in the classroom from where you came. So the idea is we are doing it for teaching, so our mission is for teaching. So all the trainees and the local doctors will be in the classroom sitting, watching, monitor, and he can see exactly what is happening in this room, what the doctor is doing, how he is treating, how he is working with the equipment, how the patient is being treated. So, and also there's a microphone so that the students or whoever wants to ask a question, they can ask. The doctor here also has a microphone here and then he can answer, so we are fully interactive. So every room, every equipment is designed for teaching. So we travel around the world and we treat all the local doctors, nurses, and other healthcare professionals. And when we reach a country, we will invite the doctors will come up the plane and then they can practice with these ones. We have a surgical simulator so that the local doctors can come and practice to do the surgery before doing the surgery so that he is really qualified to do the surgery. So this is a very advanced state-of-the-art technology. And before this technology, the only way for practicing is by using animal eyes. In those days, we use animal eyes like sheep eyes, goat eyes, pig eyes to practice. But now we have a very virtual reality technology, and you'll see that this is very much the same thing like a human eyes and real equipment. So now I will show you, actually my colleague Mario will show you a brief demonstration of how this works, and everybody can come closer and have a closer look at this, how it looks like. This is amazing stuff.
Okay, hi everybody, I'm Maria, I'm just an ophthalmologist, and I'm going to show you how the simulators work. So in this one, you can practice cataract surgery and retina surgery. We can choose from a variety of things that we can practice here, each step of the cataract surgery, and the difficulty of it. It will tell me the objectives of each one, which in this one is to remove the remaining part of the cataract. Over here, I can choose what kind of instrument I want to use. And I can modify the parameters just like I would in the OR. The pedals are the same thing as they are in the OR. The instruments are as well. They're shaped the same way. The weight of it is the same thing. The teeth will transform itself once it's in the eye to the thing that I told it to be. So I can zoom in, zoom out. Structure. First, it will point at me with a little red dot over there, and then if I grab the posterior capsule, well, it tells me to get away from it. And if I insist, I can make a huge hole here, which will happen in real life. And if I touch the cornea, it will scar it as well, just like it would in real life. The eye movement is pretty much the same thing. The feeling that I get with this instrument inside the eye is pretty much accurate. Even the sounds of the machine are pretty much the same as the real thing. And over here I can see how I did. So I failed this one, obviously. But now I can go and just repeat it until I feel safe with it, and then I can move on to the next step and next step. And then my teacher or whoever is looking over me can tell me when I'm fit for doing it in a real patient. And with this one, this is to practice how to use the real life instrument, which looks just like this. This is an indirect ophthalmoscope. It's for examining the retina of the eye, which is like the wallpaper that's inside the walls of the eye. And again, I can choose from a variety of cases, either abstract things or simulated cases of specific topics. Here it tells me what I have to do. So in the right eye, I have to find an arrow and a trident, and in the left eye, I have to find these circles and squares. I can move my parameters around just like I would. And then, as you can see, this is my patient. And then, when I look at it, it looks like a patient that blinks and smiles. So, my patient over here is very still and it's very cooperative, right? So, if I tell him to look upwards, he will do it. I'll grab my lens, which again, it's the same size, shape, and weight of the real thing. And I'll move around so I can see the retina now. And I'll point at the things that he told me to.
Circle down. Circle down. Square down.
So I can move around different ways. So I can look and search for the things that he told me to. After that, I can move on. And I can keep track of my findings. So here it is, the real way the eye is, and this is the way I see it because it's upside down because of the lens. And then I can keep track of the things I saw, change their sizes, move them around, and this is how it actually is in the patient's eye. So this is a way that we keep track of things in real eyes. For us to use that when using the laser or for doing surgery. So with this kind of apparatus, you are the one that moves along a line of patients instead of having the patient, who is often an elderly patient, move around. So it's easier, and of course the objective of this is to do it efficiently and quickly when you have a lot of patients.
Any questions? Anybody? So this is what we do, how we do, what happens on the plane actually when we visit the country. So this is for practicing, for examination. Actually, these are the simulators, but when you go to the next room, you'll see the real thing.
When you go to a country, how long do you stay at one
Normal
time?
program will take 2 weeks.
2 weeks.
That's our standard program. The duration is 2 weeks, but it depends on the country. If we have like a 3 weeks invitation, we'll stay 3 weeks or 4 weeks.
And then how do you determine the doctors that you're going to train?
We have a planning visit a year ahead before we go to the country. So actually, we do the planning for 3 times, a year ahead, 6 months, and then a month before we go, to discuss what kind of subspecialty they need. Either they want like a cataract or retina or glaucoma or pediatric. Yeah.
Great.
Yeah. So shall we move to the next room?
Thank you guys. Yeah, we can go this way now to the operation theatre. Hello.
You guys sit here?
Yes.
You guys sit here, please? Were you doing this there?
You can sit here. So you will be assistant of
Don't mess it up.
the main doctor. Hello, welcome. Come on in. You can move a little bit forward, please. Hello, good afternoon.
afternoon. Welcome to the operating room. My name is Xiao Ying. I'm from China, one of the nurses, work for Flying Eye Hospital. It's my 6th year work for this organization. So I'm going to tell you what we do normally here. For example, if we imagine this is a Flying Eye Hospital program, we land in a country, then we are going to have our Orbis doctor will sit here, always will be accompanied to local trainee doctor, but we will have more students which they are sitting outside of the classroom. With this new plane equipment, we have a 3D camera installed with a microscope. So before only surgeon can see the 3D view through these eyepieces here. For the other participants, they will not have this opportunity now with this 3D camera. Even the participants, they sit in the classroom with the glasses, they can have the same view as the surgeon will see. And we also have those two brand new machines, which they are for cataracts or retina surgery. They are the high level, like the latest generation of equipment for eye surgeries. They are donated by outcome. And this one is for general anesthesia, is an anesthetic machine. They're also new. And the new feature of this room, we have those two hatches over there. The one to the right is for passing the dirty instrument after surgery. The one to the left is for receiving the clean instrument after sterilization. So the full setting, this setting is same as a hospital. Yeah, you don't feel like a plane, right? Also, this part of the plane is located over the two wings, so it's the most stable part of the plane. Sometimes when we land in a country, the weather can be windy or not good, but you are performing eye surgery, you don't want any movement, so here is safe. For other program, we have a team will visit that country first to identify the trainees and assess the local equipment. Sometimes they don't have the same equipment like we do, but we need to plan and inform the VF volunteer faculty doctor, so they will be aware what kind of skills need to be transferred. For example, with the new generation of these machines, everything is computerized. Even for insert the artificial lens into the eye, it has a program. You just touch the foot pedal with the handpiece, it will go into the eye very smoothly. But with those country, they have an old model of those machines, doesn't have this function. You have to be very experienced surgeon to teach them manually to put the lens. Yeah. So in this way, they know the latest technology. They also will be able to keep the skills even when the plane leaves that country. We also have nurses and doctors follow up with the outcome with the patients or the trainees. And during the weekend, we also plan a big conference for accommodate more local trainees in that country. So this is how we work for transfer skills. Yeah, there are a lot of things involved. Like I'm a nurse, I also need to know how to pack this plane when this plane take off. Everything has to be locked down. If you see these speakers, remove their holes. So we have to strap the bed onto the floor and put those these eye optics has to be the boxes that are centered in a specific area, and everything is tied to them. Do you have any questions about this?
So you do surgeries while flying, not
No.
just
No,
just on the ground.
Airport. But at the same time, we have different teams who will perform surgery in the local hospital.
Yes. And how many
How many
surgeries would you do when you land in a country?
So in the country, normally we will stay there for 2 to 3 weeks. That's the on average. But in the a daily basis, because we are teaching, everything takes slower. So 5 to 6 cases on average in one location. That means one day maybe we perform 10 to 12 cases together.
10 surgeries a day?
Yeah. In the hospital, maybe cataract takes only 15 minutes, for example, but on the plane it takes 40 minutes plus preparation and explaining. The doctors will ask a lot of questions, what kind of equipment you are using in the eye, for example. And also the translation will take some time.
I was going to ask about the translation.
Yeah, we have translators. In some countries we can get simultaneous translation, but in some countries the language is really hard to find a professional one. But fortunately we have more than 14 languages on board.
Okay.
For nurses, we have 5 staff nurses, all from different countries. I'm from China, head nurse Angela, she's from UK, and we have nurses also from Peru, Philippines,
What about for
South Africa.
with the work that they're doing in Ethiopia? That's difficult. Is there a language barrier there?
Ethiopia, they do speak English, I think.
No, they speak Amharic in Ethiopia, and they have
doctors.
difference. Their national language is Amharic.
Yeah, but the doctors normally in those countries they speak English. Yeah, that's why I don't have in China for sure. No one speaks. Yeah, but I will be there for the program. Yeah. As well in Philippines, they generally also speak very good English. In Indonesia and the Vietnam, which is we are going next, they don't speak English, especially for nurses. But doctors, they generally speak better English than nurses.
What's this?
These 2 ceiling lines. So some surgeries we don't need microscope, like eyelid surgery or ptosis, strabismus. So this will be moved away. We have to use that light.
Okay.
And this camera is for record those kind of surgery. Because this one is already recorded. But when you do strabismus, this is the camera is going to be used.
Do you all measure the air quality before you start the surgery?
Yes, so very good question. As I mentioned, we have dirty substerile room. That room is in negative pressure, and the other clean OR and the next autoclave room, they all positive pressure. And our engineer is the one to check on a daily basis. Once they open the plane, everything is set up.
Thank you.
Thank you. Okay, you can move forward and you will see substerile room as well on the past side.
Thank you very much.
How are you?
Yes, good.
Come in, everyone.
Come in. Any more? Yeah, okay. Hello everyone.
Hello.
Welcome. This is called the FedEx pre and post-op room. In other words, FedEx sponsored us this room in addition to everything else that FedEx donate to us. They also let their pilots come and fly us everywhere we go. Yeah. My name is Angela, and I'm the head nurse of the Flying Eye Hospital. And this is where all the patients pass through. I'll tell you this story from the start. The patients are admitted at the local hospital night before surgery. Day of surgery, they're transferred to the plane by ambulance, escorted by a local hospital nurse, who hands over to us the patients, and they wait in the laser room because they're still getting seen by the surgeons to make sure the correct eye is marked to coincide with the correct consent form, etc., etc. And again, the last time to educate the patient, because we're educating them from start to finish and to make them understand why they're having the surgery, etc., etc. In the meantime, we're doing the same, preparing everything, because each bay will have a monitor, just like in any up-to-date surgery center. We are accredited by the American Association of Ambulatory Surgery. Basically, we can be classed as a center of excellence, flying around to other countries to teach the local doctors and nurses how to improve their skills and knowledge to coincide with the WHO way of working and safe. And it has capacity of 3 beds at any one time in here. So when we have everything set up, and from the time we come on, we're teaching. So I'll have my 2 nurses with me. The anaesthetist will have his 2 anesthetists. In the substerile, there will be 2 nurses all from the local hospital, and in the OR there will be another 2 nurses and 2 doctors. And depends how long we're in the country, could be 2 to 4 weeks. We interchange with the local hospital, so they have a go on the plane, and we have a go to teach them in their own environment. So the pattern would be, this is patient number 1 who has already had surgery and halfway to recovering. Patient number 2 is now having surgery, and this is patient number 3 who we will prepare to go in after. We do many types of anesthesia. We do from topical, local and sedation, or general anesthesia. We do children as well, and they will have general anesthesia. One parent is allowed to accompany the child down here while we prepare them for surgery. Obviously, not every child will let us go near them. They don't like strangers, especially strangers who doesn't speak their language or who they don't understand. So we will have a couple of interpreters in here. Local interpreters. They have to be spontaneous and understand ophthalmic medical terms. So there's no gaps for communication while we're here. So if the child, if you like, doesn't want us to play with them, but we will still make them relax. All children are given a little teddy this size. I'll give them my stethoscope. They can pretend to be the doctors. I'll give them the mask we're going to use while we're in the OR on them to play around. I'll give them a little iPad, let them play game, etc. And then normally the child will be pushed in on the trolley, but we'll just let the parent carry them in, and then we'll put the child to sleep in the OR. At that point, we'll send the parent for a cup of coffee. Then we'll do surgery. And then after surgery, the child will come sleeping on the trolley here. And I'll recover them in this position because it's next to my emergency kits, just in case. Never have to use it, touch wood, but it's there ready. Also, Teddy will also have the same site, same surgery, same site as the child. And sometimes the child is ready to pull the patch off, make a fuss, whatever. But when they notice that Teddy also had surgery, they're so empathetic with Teddy. They forget their own problem. Anyway, so once we discharge a patient, the length of time we keep them in here really depends on each individual patient. Even if they had a topical, they don't really need much recovering, but I will think ahead of the journey they have to travel. Sometimes it's quite ruggedy, rough roads, rough ride in the ambulance, so I might sit them in the corner and give them something to eat and drink, and before I feel satisfied that they can cope with that journey, I'll discharge them. But before we discharge them, we'll make sure they have their medications, their drops, their dark glasses, everything that's necessary, so they don't have to worry about finding these things or affording to get them. We also educate them on hand hygiene, infection control, which medicine, which drops at which part, which time, etc. Once they leave here, they go back to the local hospital to stay overnight, because the next morning they will be seen for post-op by the same surgeon that did the surgery the day before. And that's when the patch will come off, and that's when it's very emotional, because everyone is happy. It could be a parent that for the first time the child is walking towards them, because unaided, if you like, or a grown-up that might see the light for the first time. And the following day after surgery, even if the vision isn't fully, it's every day it will be restored. So maybe by the end of the week they will really see what their partner looked like, or they will see at the end of the road someone walking the dog, or things that they didn't know before.
Wow.
Yeah, so it's fascinating. And our last program was in China. And the surgeons that we teach here are surgeons that are already doing surgery in their local hospital, but they just need to update their skills and knowledge and different technique and understand quicker or more modern ways. And this particular surgeon had never seen a cornea graft, but by the end of a week he was able to do one by himself. And then he informed us that he will be able to do the other eye and teach his colleagues in the local hospital. And 5 weeks after we fly away at the end of a program, but 5 weeks, a team will go back to that hospital for the surgical review and to check the patient's visual acuity, to see how it's going on, do audit for infection control, etc., etc. Continue to support the surgeons, and continued support is always available by cyber-site telecommunication from the same surgeon that trained the same local doctors on an ongoing basis, really. Yeah.
Very good.
Any question?
How large is your crew size?
Okay, so the whole crew on this plane, that's full-time and that's our permanent job, is 21 of us, and different things we do. For example, I'm the head nurse. I have a core team of 4 staff nurses, and we have logistics, biomed, doctors, staff ophthalmologist doctors. The rest is made up by the voluntary sector. So Orbis has over 400 voluntary sector, which is like biomed, pilots, nurses, doctors. So the consultant surgeons are all voluntary. They give up a week of their own private practice. They take a leave and come to join us. Some take 2 weeks as well to join us. And it depends on the subspecialty. It will be those surgeons geared for that subspecialty that will come. So they are the surgeons that are in the know, up to date, and know everything of the future trend.
So does everyone meet at the aircraft and then you all take off and go to the country that you're...
Yeah, it depends. For example, we're going to Vietnam, which is the first program for 2017, in end of April, beginning of May. Because that's the first program, we need to restock the plane. So we have a warehouse in America, and all the stuff, all our consumables, everything that we need will be shipped to the warehouse. They will ship it to where we will do the restock, which will be in Dubai. So we will fly to Dubai, all of us, and do the restock, all the manual work, re-sterilize all the instruments, everything. Then we will all fly together on the plane to Vietnam. We will also be the flight attendants. But, for example, the next program will be Cameroon. So we might have already restocked on the plane Cameroon stuff. So if we're at home, then we fly commercially to, say, Cameroon. But the team that's leading that program will be a week already commercially in Cameroon. We will all arrive, everyone will arrive the day before the plane and we will all go to the airport and meet the plane.
Oh, that's
And
so
we're excited every time. There it is, the little duck coming in.
That's great. Angela, thank you so much. Thank you
Thank
so
you very much.
Okay.
I don't know.
That's it. You were the last one anyway with Hans, weren't you?
Yeah. Thank you very much. Sorry?
Hans coming with you.
I don't know.
That's it. You were the last one anyway with Hans, weren't you?
Yeah.
Oh, yeah, there he is.
Too low, terrain. Light slope. Bank angle, bank angle. Too low, terrain. Caution, terrain. Caution, terrain. Terrain, terrain. Pull up. Caution, obstacle. Caution, obstacle.
Yep, started.
Light slope. Pull up. Terrain, inoff. Runway, awareness, not available. Sink rate. Pull up. Terrain. Pull up. Don't sink. Don't sink. Too low, terrain. Too low, gear. Too low, flaps. Too low, terrain. Light slope. Bank angle, bank angle. Too low, terrain. Caution, terrain. Caution, terrain. Terrain, terrain. Pull up. Caution, obstacle. Caution, obstacle.